My name is Allison Sedlak. I am an adoption and foster care caseworker through Catholic Charities of the Diocese of Greensburg. Like I said, I've been working in this field for about 3 years. Prior to this, actually, I've been working with at-risk children since I was a child. So I have a relatively broad spectrum in terms of working with kids who have been in the system or are at risk of being placed in the system. I will admit, though, that there are a lot of things I don't know. So if you have questions that I can't answer, I will tell you I don't know. But I will do my best to find that answer for you. And if I can't find it, maybe your caseworker or the staff through the agency that you're going through can. Because everybody who works in this field, we all have different experiences, different perspectives. So the answers that I don't have, somebody else may have. Does that make sense? Okay, so what we are going to cover first is, as you can see, who are the children? What we are going to cover in this class, there we go. We are going to talk a little bit about birth family issues because it ties into everything that our kids face. You will have a class at some point called Who Are the Parents? They will go in much more depth at that point into all like the circumstances and the dynamics that can play whenever we have kids who come into care. But we will briefly go over that today just because it does all tie in together. We will talk some about the range of disabilities that can occur with a child who is in placement. It doesn't always mean that the child has physical disabilities or mental health, but every child that comes in does have some level of trauma, and that does impact them significantly. We'll look at the adjustments that will need to occur between placement and finalization because it is a long process and there are a lot of adjustments for you and the child both. And you guys are going to examine your openness to the kids that we have in care because we have kids from all different walks of life. We have kids of different ethnic origins. We have kids from very different cultural origins as well. So that's something that you want to keep in mind as we are going throughout this class is just what it is that you are open to when it comes to taking in a child. And we are also going to look at what your expectations are of a child who may be placed with your family. Okay? All right. So the next thing that we are going to do is I want you to think about your perfect family. If you could and leave out all of what you know or what you think you know about foster care, I mean the absolute ideal perfect family. What I want you to do is on that big blank piece of paper, you can either do it as a couple or you can do it individually, it's up to you. Draw a picture of what your family looks like. And I'll give you a couple of minutes to do that. There are crayons, there are markers and colored pencils on the table. If you need more markers, I do have more of those and a couple more crayons, but go ahead and take a couple minutes and draw what your absolute ideal family would look like. Go ahead.
Whatever it is. You're the art teacher.
Think about things like what the child may look like, and you can even go so far as to their hair color, their eye color, what skin tone they may have. Do they like to play sports? Are they into music? Do they like art? What would you do as a family? Where would you be in this picture?
Did you reference family or are you saying child? I just want to be clear.
Well, this is your family. So if you're bringing a child into your home, what is your family going to look like, whether or not you have your own children?
Thank you.
Mm-hmm.
You're tall. Taller. You're gonna get taller as you go. I'm the same height as you. Now I see what your perfect ring is. You are my every day.
to remember that.
She didn't say anything.
Where's the bone?
Brown hair. Alright. Oh. How about this a question? Doesn't matter.
She can just pick.
Is that wire or grass? Just for the size too. Where's our house now? Our house right this is right. Also. That's my crossword.
Okay, I'm going to give you about 2 more minutes.
Oh, now we're getting time.
Well, I mean, if you'd like to go to lunch today, it might be a good idea if we keep moving at least a little bit.
Cities.
I'm not sure it's human. Everything in this page looks resembles human at first. Close to the city.
I am going to warn you, we are going to talk about this. So if you drew stick figures, it's perfectly okay. I would draw stick figures too.
It's okay, or one just has some tentacles.
The track.
That's okay.
Everything that I can think of. Suitcase. Because I don't know how else to do the world.
Okay, utensils down.
So,
Okay, James and Jennifer, can you tell us what your ideal family looks like? Where are you? Which is the child in your family? What does that child look like?
We have children.
Okay.
We have animals, we have traveling, we have sports
Okay.
and leisure.
Okay.
Very outdoorsy, and then live in the suburbs but close to a city.
Okay. Okay. Okay, Brad and Alyssa, what does your family look like? What does your child look like?
we're at front of our house. We
Okay.
have us. I still have my beard. We've lost some weight. And then we have our 5-year-old daughter, our 9-year-old son.
Okay.
And we put in a foster child in the middle, but we really don't have a whole lot of ideas on whether we would prefer a boy or a girl or gender, race, etc. So.
Okay. Barry and Amanda, what does your ideal family look like?
Huge.
Huge.
We already have 9 children,
Okay.
so we have that in the picture.
Yeah.
We have only 2 boys out of all of our
Okay, so 2 boys out
massive
of
girls in our
Okay.
family. So,
2 boys and wow, 7 girls.
yeah, but we like to camp, boats. We like sports.
Mhm.
Most of it's boy sports, but we're trying to. We're getting used to the girl sports, I guess.
Okay.
But if and when we do take more children in,
Mhm.
it's never bothered us as far as race, sex. We've taken
Okay.
all in over the last 12 years. So.
Yeah. Okay, I gotcha. Okay. So we are thinking about what our ideal families look like, and whether or not we consciously think about it. Most of us have some level of expectation of what the child coming into our home is going to be like, or will act like, or they will fit in right away, or they're not going to fit in at all. So those are just some things that I want you to be aware of as we go through this course, is what your expectations for a child in your home are. Because what your expectations for them may be could be very different from how they actually are or the home that they came from. So just keep those things in mind, okay? So we are going to talk a little bit about birth family issues, but first I want you all to think about your childhoods. Not the kids that we may be working with, specifically yours. What do you remember about your childhood? Any volunteers? It can be good, it can be bad. Barry, go ahead.
I like hunting, fishing, boating,
Okay.
outdoors.
Lots of outdoorsy stuff?
Yeah, I was at sports, love sports.
Okay.
Like wrestling, football and stuff like that.
Yeah, lots of
I remember
sports.
all those things, doing those things when I was a kid.
Mm-hmm. Okay. Anybody else want to share about their childhood?
First thing that comes to mind is just playing outside with the neighborhood kids.
Playing
We were
outside with the
always
neighbors?
just in the woods and
Okay. Romping around,
playing
causing a
kickball on the
ruckus?
street and, yeah,
Okay.
all the time.
Okay. So some things that I want to ask you about are, did you live in the same house growing up? And if you didn't, that's okay, but how many of you did live in the same house for at least most of your childhood? Okay. Did both of your parents raise you? For the most part, yeah? Okay. Did anybody have siblings? Siblings? Okay. Did you feel loved by your family? Yeah? Everybody felt loved? Okay. Did you feel safe at home? Yeah? Well, the thing, and unfortunately, that's the reason why I have a job and why you are here. How would that be different if you were taken from your family? What do you think? If you have siblings, how would your relationships with your siblings change if all of a sudden you find yourself in the back of a caseworker's car and you're going to a home with people you don't know? Or maybe to your grandma's house because you're staying with grandma while mom and dad try to get their lives together. How would that change? What do you think? And you can be honest with me.
It'd be scary.
Yeah.
considerably.
It'd be
Yeah.
scary. Anybody else have thoughts? How would your life change if all of a sudden, the house that you lived in for the past 5 years is no longer where you're going to be staying for an unknown period of time? What do you think?
Could be good, could be bad.
Could be good, could be bad. Mm-hmm. Anybody else? And this isn't to trick you. I promise. It's just to get you thinking.
I'd like to think that it would be less traumatizing for a 3-month-old to be removed from a home than someone that was 6 or 7 that has had the experience of being in a very loving home with siblings.
Okay.
But I don't know if that would be any different, but I'd like to think that at 3 months, it is drastically different than a 6 or 7-year-old.
So you think
Or even a 15 or 16-year-old, I think we were all there, couldn't wait to get out of the house
Mhm.
because we couldn't wait to be an adult, but not really understanding what those responsibilities were.
Okay, so you think age plays a factor in...
I'd like to think that it does.
Okay. So if we are putting ourselves in the place of a child that has been removed, because that's exactly, again, why we're here. We are taking children into our homes who are no longer able to stay with their birth parents for a myriad of reasons. Kids in care do not think of normal as we see it. As it says up here, normal is not normal for everybody. What seemed normal for the panel that we took was that most people had stayed in the same home throughout their childhood. They were raised by both parents. They got to play with the neighbor kids or go out and play in sports or do things that interacted with the community. Whereas a lot of our kids that come into care, they don't always have both parents staying in the same home. Sometimes they move frequently because their parents aren't able to maintain housing. And sometimes because of a lack of funding, monetary resources, or because their parents are not specifically involved in their lives, our children don't always participate in community activities, whether it is playing in sports or extracurricular activities after school like band or participating in art or things of that nature. Sometimes that doesn't happen because of a lack of resources or a lack of parent participation. So what we consider to be normal is not necessarily normal for our kids. So something that everybody needs to keep in mind, and whether it can be frustrating, but every child's primary goal when they come into care is reunification. Does everybody understand what reunification means? Okay. So reunification, they go home with mom and dad, or mom or dad, whatever that looks like for them. And because their primary goal is initially reunification, we also have visitation. Is anybody familiar with visitation in foster care? Okay, so when a child comes into care, up until the point where the courts and the county agency determine that their birth parents are no longer fit to take care of them and they are looking toward permanency, these children have visitation with their birth parents to maintain those relationships so that if or when they are able to go home, they're not walking back into another stranger's house because they haven't lived with their mother for a year. So there may be some differentiations, especially when it comes to visitation, between what you are expecting of them and what their birth family is expecting of them. So those are some things to keep in mind when you have a child in your home. What they are able to do or what they're expected to do at visits could be very different than what they're able to do or they're expected to do in your home. And you may see some of that in terms of behaviors. It is not uncommon for a child who goes to visitation to have some sort of a behavioral reaction or an emotional reaction after visitation. Especially, we see it a lot with younger kids, but even older kids have it as well. Sometimes that period of transition where they go from the visit to your car or the worker's car and then into your home, it can be very trying for them because they have just seen their birth parent, whatever memories are surrounding with that birth parent, whether they are positive or negative. So then in transitioning home, our kids don't always know how to process their emotions and their feelings. So sometimes what they're feeling in the visit, whether it is positive or negative, like they didn't want to leave mom or they didn't want to see mom, because that does happen too. Sometimes that transposes to after they leave the visit. And you may see some acting out after visits because they are trying to process everything. They're trying to process not being at home. They're trying to process the fact that they are now living in somebody else's home, whether it is a kinship home, somebody they know, or a foster home, somebody they don't. And they're trying to wrap their brains around all of it. And sometimes it takes a while, and sometimes after every visit, you're going to see some behaviors. As we go throughout this training, you're probably going to think, oh my gosh, what the heck am I doing here? This is like the absolute worst thing we could have possibly done. I'm basically giving you worst case scenarios to prepare you for what could happen. There's no guarantee that that would happen. So just because we talk about some things that are really hard, or that they could be really, they could seem like negative experiences, it doesn't mean that it's going to happen that way. That's just how we are preparing you for whatever may come your way, because really, we don't know for sure until that child is placed in your home. Does that make sense? Okay. Yes. Something else that we will see some of is that traditional family roles can be challenged. Sometimes we have parents who are acting as children, and it does happen. Sometimes we have children who are acting as parents. We see this a lot with sibling groups, especially if there is one child that has taken over a parental role. Usually it's the oldest. It doesn't always pan out that way, but we call them parentified children. So whatever mom and dad were doing at home, they were not there to take care of the children in the home. So the child who has assumed the parental role is now taking care of the younger siblings. But when they come into your home, sometimes they have a really hard time letting go of being the parent and just being a kid. So that's where we come in teaching children to be children. And honestly, it doesn't really matter so much what age. You can see this even with children as young as 1 or 2. When they have younger siblings, they want to protect their siblings. They want to take care of their siblings. So you may even see parentified roles in children who are very young. But especially with children who are older, who have a better understanding of where to get resources such as food or clothing or whatever they need for their siblings, they are really going to have a hard time separating those two roles and allowing themselves to be children instead of parenting their younger siblings, which they have done up until the point that they leave their home. Does anybody have any questions about that? Okay, so there are, I think I need to go to, yep, I switched them. Okay, so I got my slides mixed up, I apologize. But there is what we call a cycle of abuse and neglect. If you really look at the records in foster care and adoption, when kids come into care, it's not usually the first generation that has. Usually it's going back at least 1, sometimes 2, sometimes 3. So whenever, let's say you have a 10-year-old that comes in and his mom is 25, chances are his mom was either in the system or had circumstances surrounding her life that could have placed her at risk for being in the system. So if we are looking at this cycle, we start with when a child is conceived. Is the pregnancy wanted or unwanted? So if the pregnancy is wanted, sometimes there are more resources that are available, but sometimes not. Sometimes parents want their children, which is great, but they don't always have the support that they need. So they don't always have grandparents who can help back them up and help support them whenever that child is born. They don't always have the mother doesn't always have the significant other in the picture who would be that support for them. They don't always have the financial resources to take care of a child. So when that child is born, we come to the point of whose needs are met. And I'm not talking about whether or not a child or a parent is receiving food, though sometimes it does boil down to that, but we are looking at whether or not the child is being taken care of. And the parents' needs are being met to a point, but are the child's needs being met simultaneously? So that doesn't always happen. And then we go to that parentified situation. Sometimes our children are taking care of their parents like they are a child. At some point, one of my coworkers had a 6-year-old boy who, when it came to time for him to be adopted and parental rights were being terminated, all he wanted to know was that his mom was okay. He just wanted to make sure that she was being taken care of instead of the roles being reversed. Like a parent-child relationship, the roles had been switched. But when a child is parenting a parent, more or less, then they don't learn how to trust adults because the adults in their lives are not trustworthy. They have learned that for survival, they can depend on themselves. They can depend on their siblings, but maybe not on the adults in their lives, like their birth parents. Sometimes they can go to grandparents or aunts and uncles, people in their lives who have stepped into that role of being able to show them that adults are trustworthy, but that doesn't always happen. And with a lot of our kids, they'll come into your home feeling like they can't trust you because they couldn't trust mom or dad at home. So then at this point, that child withdraws into themselves because if they can't trust the adults in their lives, who can they trust? especially if they don't have siblings. So if they can't trust adults and they're looking only at the experience that they have or the experience of people their age, sometimes they lose belief in themselves and their ability to do better and their ability to get beyond whatever trauma that they've suffered through. So then that losing the belief in themselves, it leads to poor decision-making skills and sometimes poor relationships. So this 10-year-old, let's say now he's 18, but he has never learned to trust an adult up until, or even beyond his 18th birthday. At this point, maybe now he is stealing from grocery stores because he doesn't know how else to get the food that he needs. He could be running with a very negative crowd, whether it is a gang, because gangs are very real and very prominent in some of the cities. He could be into drugs by this point. Unfortunately, a lot of children sometimes turn to drugs or alcohol as a coping mechanism for the trauma that they suffered when they were younger, and it does start very young. But there is that element of poor decision-making skills, and then they're in poor relationships. So they don't really know what a healthy relationship looks like. So whatever they learned from their birth family, that's how they look at relationships now. And then that child chooses an inappropriate partner. So whether it is our 10-year-old boy who chooses a female or a male who is an inappropriate partner, or a lot of times we see it with females who choose an inappropriate partner, then that partner is non-supportive because they're dealing with their own trauma of whatever happened in their lives, whether it is something that happened with their birth family, just a traumatic event that happened to them in general. Sometimes we have kids that just get in with the wrong crowd and it takes them down a really, really negative road. And then we're back to square one. A child is conceived. Is the pregnancy wanted or unwanted? And this cycle will continue for generations. Like I said, there was one case that I worked with a young lady. Her mother was in the system at some point, and although they did everything that they could to help her mother, all of her children were displaced from her home. And up to the point that I was working with this young lady, all of her siblings had been adopted or had some other form of permanency. None of them were at home. So part of our job, if we can, is to help break this cycle. Because these kids need to learn who is the parent. You know, the adults in their lives are the ones who are supposed to take care of them, not the other way around. And that they learn that adults can be trusted. Because if they have an adult in their life who they can trust, they can rely on, a lot of times all this other stuff, even though some of it may happen, it may not wrap back around to this person's child being in the system. Sometimes that cycle breaks because there is an adult in their lives who can be that role model for them, who can show them what healthy relationships look like. So those are some things that you want to keep in mind as you're working through all of this craziness, because it does happen in almost every family that we work with. Okay? So now, we gotta go back the other way. Okay. So as you can see, there are 4 types of abuse and neglect. We usually look at physical abuse, physical neglect, emotional abuse, and sexual abuse. Let's start with physical abuse. Can anybody give me any indicators of physical abuse?
Bruising.
Bruising, okay. What else?
Laceration.
Lacerations. Okay.
Burns.
Burns. Okay.
Could it be like an expectation of being physically abused, like say as punishment or something like that?
So an expectation such as...
Say they do something wrong and then like they, I don't know, expect to be hit or
They expect to
slapped
be...
or
So
something.
how would you notice that they're expecting to receive some sort of physical backlash?
Timid.
Say that again?
They're being timid.
They're being timid. Okay. Anybody else? Can you think of anything behaviorally that may indicate...
They overreact when they do something wrong.
Overreaction when they do something wrong.
They physically abuse other people.
Okay, physical abuse of others. I want to go back to the timidity. Barry's right. Sometimes children are very timid. They tend to withdraw and keep to themselves and do everything they possibly can not to cross a line. In tying what Barry said and what James said, sometimes what you may see in their reaction of that expectation of being hit is the flinch. So whether it's putting their hands up or they're tensing up, waiting for a blow, that may be an indicator as well that physical abuse may have occurred if they're anticipating some sort of physical backlash for something they may or may not have done. What might be another behavioral sign of physical abuse? Anybody think of one?
I don't know how this would tie in. Maybe it's physical neglect, whether you overfeed them or underfeed them.
Okay. What do you mean? Overfeeding or underfeeding?
Because it's taking a physical impact on their body.
Okay.
If you don't, yeah, I guess that would probably, what type of abuse is that going to fall under besides just pure neglect?
Well, it can fall under both, actually, feeding. Sometimes parents, in really terrible circumstances, will take away food as a punishment. But there are cases of just physical neglect where the kids just aren't fed. Whether it's because their parents are selling food stamps for drugs, or their parents aren't home, so the house has run out of food and the kids don't know where else to get it. So it does fall under both categories. Really, it's the motivation as to why there is no food, or the reason why there is no food. So if it's a punishment sort of thing, like if you got an F on a test, you're not going to eat for 3 days, then that would fall more under physical abuse. Whereas if it's just a lack of food in the home for whatever reason in general, then that would fall more under physical neglect. Does that make sense? Okay. So let's then move on to physical neglect. What are some indicators that a child may have suffered from physical neglect? Malnourished, okay.
Dirty.
Okay, they're dirty. What do you mean by dirty?
Dirty clothes, haven't showered, just unkept.
Okay. Okay, anybody else?
Hoarding food,
Hoarding?
it does.
Okay. Okay, anybody else?
When they're sick, they don't take them to the, they don't get the correct medical care,
Okay.
whether it's a dentist or
Mm-hmm.
whatnot, yeah.
Yeah, the dentist, getting them medications if they're sick. Okay. Anybody else?
What about shelter?
Shelter? What do you mean?
I mean, some of these kids could be homeless.
That's true. So a lack of housing.
Mm-hmm.
Okay. Okay. Anybody else think of anything for physical neglect?
Not being supervised.
Not being supervised. That actually is a big one. There have been, actually I've seen a few cases where children were either running around outside without their parents having any idea of where they are, and they were young at the point, 2 or 3 year olds running outside without parental supervision. I believe one kid ended up on a roof and someone else was hanging out a window. So that not being supervised is a very big indicator of Neglect. Excuse me. Can anybody else think of anything for neglect? No? Okay. So let's move on to emotional abuse. What might be some indicators, excuse me, of emotional abuse?
Probably could have left timidity out there.
Yeah, timidity.
Overreaction when things go wrong.
Okay.
There's a lot,
Like what?
The kids with emotional abuse, they'll do things themselves, like cut themselves,
Mm-hmm.
things like that.
So self-harm?
And yeah, self-harm.
Okay.
Harm to others,
Yeah.
they're mean to others, yeah, they act out on others.
I don't like that.
Anybody else?
They use the words that their biological parents would use if they say you're stupid, you're fat, you're nobody. So they kind of mimic the same language of the abuse.
Okay, so they mimic whatever they suffered at home, the language of the abuse they suffered. Okay.
Maybe this is similar, but lack of self-confidence.
Okay, a lack of self-confidence.
Always looking for attention.
Always looking for attention.
Mm-hmm.
Mm-hmm. And that can be both positive or negative. A lot of times when children are looking for attention from adults in their lives, they act out negatively just so that they can get the adult to pay attention to them. So that's something that you want to be aware of. If a child is continually acting out negatively, maybe they're looking for that negative reinforcement because that's all they got at home. So what they need is the flip of it. They need that positive attention from the adults in their lives so they don't have to act out negatively in order for adults to pay attention to them. Okay.
Depression.
Depression. Okay. Sometimes anxiety as well, wondering what, and it goes into that overreactions piece, feeling anxious all the time about what the adults in their lives are going to say to them if they have something that happened to them at school, or just how the adults are going to react to them. Okay, anything else? Okay, now we'll move on to the one that seems hardest to talk about because it can be one of the most traumatic types of abuse is sexual abuse. What are some indicators of sexual abuse?
Bedwetting.
Bedwetting. Okay. Acting out.
I think mimicking some of those behaviors too.
Mimicking some of the behaviors. What do you mean?
Just however they've been treated. Inappropriate touching
Inappropriate
or
touching?
just
Okay.
language or
Yeah.
whatever they're seeing.
Yeah, inappropriate sexual behavior is pretty common in that regard. With that, especially with children who are around 2, 3, 4 in that age range, they're also in their development learning about their sexual body parts. So some of that sometimes stems from their development. But there are inappropriate sexual behavior is an indicator of sexual abuse. So you want to, that would be one you want to look more in depth to, just because it could be part of that developmental stage, but it could potentially be this. Okay?
They act out sexual behaviors, meaning I see the acting out because they're just acting out, but if they were playing with Barbies or animals and you can see them kind of acting out sexual acts.
Okay. Acting out sexual acts. Can anyone else think of anything?
I would say anxiety or depression.
Anxiety or depression? Okay. Sometimes what we see,
Psychiatrically, it affects them.
what were you gonna say, Barry?
Psychiatrically, it'll affect them.
Psychiatrically, what do you
Yeah,
mean?
They have problems like,
They
Yeah.
think they always need,
yeah,
if they were abused by a guy, they think they always need a guy and they'll
Okay.
lie about it.
yeah.
Okay. Okay, so we'll call those, because it can,
It's one of the same
like you said,
signs.
you know, psychiatric or psychological.
That's it, psychological.
So they have psychological issues.
Yes.
And Barry and Amanda are right. Sometimes, especially with females, sometimes they feel like they always need to have a male in their life, or they act inappropriately with males. Sometimes there's also the reverse effect. Sometimes they have a real aversion to the sex of the person who abused them. With females, we tend to see it with males, but it can happen both ways. So that with the psychological issues, it is an inappropriate relationship with the person of that sex, whether it is that complete and total withdrawal. They feel like they are going to suffer that abuse again by somebody of the same sex as their abuser. Or, like Amanda said, you know, they feel like they have to have a person of the same sex or of the same age even in their life, and they interact with them inappropriately. So those are some really big indicators that something may have happened to a child who's been sexually abused. Can anybody else think of anything? Okay. So I will tell you, just in my personal experience, other caseworkers may have had different experiences. There have only been a few cases out of the children that I've worked with where abuse has come into play. It does happen. I'm not telling you that it doesn't, because it absolutely does, and some of the cases that it happens with are absolutely horrendous. But most of the kids that I have worked with, and from what I have seen, their issue is neglect with their birth families. We have a lot of kids who come into care because of drugs. The drug epidemic in this part of the state, and honestly across Pennsylvania in general, is rampant. Whether it is down here, it's heroin is a very big deal. Up north, sometimes it's methamphetamines. Some places it's cocaine. But drugs are a very rampant factor in these scenarios as to why our kids come into care. But with the drug epidemic, sometimes we do see the types of abuse, because a birth parent, when they are on some sort of substance, isn't making safe decisions for their children. Sometimes they allow the people into their homes who are very detrimental to their children, whether it is physical or emotional abuse. Sometimes it does boil down to sexual abuse at the hands of someone who is allowed into their home. But the neglect part with substance abuse being mixed into it is a really big factor with our kids that come into care.
And that comes with we've seen it with
Mm-hmm.
drug addicted babies,
Drug addicted babies
which that carries on for a long time.
Yeah.
It takes a long time for a kid
to recover from
Yeah.
that. Yeah, and that's something we'll talk about in a little bit, is some of the repercussions that can happen when you have all of these factors playing into a child's life. Okay, now we can go back past that. Okay, so does everybody understand what trauma is? What is trauma?
physical and psychological trauma.
Yes, there is physical and psychological trauma. Can you give me an example if you can't describe what trauma is?
Somebody dying in your family,
Okay.
something major happening, a big event like someone you really love, care about, that's trauma.
Okay. So the death of a loved one in your family can count as trauma. Okay.
Like sudden trauma, you know, they
Yes.
suddenly died.
Sudden death of a loved one. What else?
Foster care being pulled from a family.
Yes, in foster care, being pulled from a family can be traumatic. What else? How about a car accident? Can a car accident be traumatic? Okay, so that could be counted as trauma. So trauma can be a lot of different things. It looks very different for different people. But it is anything that has a significant impact on you, to the point where you have a very different outlook of life or of that particular situation. So with a car accident, if it was a major car accident, for instance, somebody I know went through, he was hit directly, like a drunk driver slammed into his side of the car. And when that happened, in reality, he should have died. He had a significant laceration on his leg where he would have bled out. His side was ripped open, things of that nature. So that is a very intense, traumatic situation for him. And to this day, he can ride in a car, but to go to the place that he was headed when that accident happened, he won't do it because he has that memory of that accident. So when we look at trauma, especially with our kids, when we react to something, we have a baseline of the level of reaction that we have. So you're in traffic, somebody cuts you off. How are you going to respond? How do you normally respond when someone cuts you off in traffic? The deer in headlights look.
I'm like, really?
Like, what just happened? Seriously? So it's that irritation, right? So let's say that you had a traumatic experience where the last time someone cut you off in traffic, you lost your brakes and you slammed into the back of that person's car. So if you have a memory or an experience with trauma, your baseline is no longer here in traffic. Your baseline may have jumped up a little bit to where when someone cuts you off, you may slam on your brakes right away just to know that they are there and that they're going to stop the car, because the last time that you had that experience, that didn't happen and you slammed into the back of this person's car. So if we're looking specifically at our kids, whenever your parents yelled at you, or let's say you got an F on your history test and you had to take that home and have it signed, what would your reaction be to having to take that home and have your parents sign it? What do you think? Your reaction, not the kids, your reaction.
Like our reaction as a parent?
Your reaction
Or
is
child.
if you were the child who was
Okay.
taking home this test to be signed because you had failed it, what would your reaction be?
I'm terrified,
Terrified? What do you mean?
just because I knew I would have let my parents down. Education was
Okay.
important to
Okay.
me.
What their expectations?
So you let your parents down, you didn't meet their expectations. Okay. Can anybody else think of anything? How would you react? Okay, so we'll take that. You're terrified because you let your parents down. How do you think they are going to react to having to sign that paper?
You're gonna get lectured.
Okay, you're going to get a lecture. Maybe grounded. You're not allowed to play with your friends until you bring your grades up. So if you are a child in care, let's say whose mother or father has a very, very quick and very, very fiery temper, and you have suffered some of this emotional abuse. So instead of this baseline reaction where you might get a lecture, or you're afraid you might get a lecture, or you might get grounded, instead, your baseline of trauma may be here. If they're afraid that they're going to be called stupid, or that they're no good, that they're never going to amount to anything. Or it may be up here, if they're going to get slapped across the face because they failed a grade and they were told, if you fail another one, I'm going to beat you. So depending on how or what trauma the child has experienced, what we might consider very low-lying, very normal reactions to things. So being terrified that you're gonna get grounded. Their reaction may be, I don't want to go home, because their experience has been, the last time my mom slapped me across the face. So whenever you have a child in your home, if they overreact to something, usually it's because their level of trauma is up here, or even up here, to where they are on guard all the time, waiting for the other shoe to drop, waiting for something to happen, because that's what the experience has taught them. So in having this child in your home and working with them, it may take some time to help bring their reactions to things that happen to them down. Because as we know, not everything that happens to them is going to be traumatic. There's not always going to be abuse or neglect associated with all of the things that happen to them, but they don't know that. So that's why we call that fight, flight, or freeze. Has anyone heard of that before? So whenever they find a situation threatening, whether it is legitimately threatening or not, they either fight back, so sometimes they act out, they freeze, they don't do anything, or they run. They withdraw into themselves. Sometimes kids actually run away. But that is how they react, because that's how they've survived up to this point. So these are some things that you want to keep in mind whenever a child does react so strongly to something that in our sense of normal would really be down here. Does that make sense? Okay. So some of the effects of trauma, and I apologize, this is like 3 slides long, but these are some things that you may see. Sometimes kids internalize the messages that they hear, that they're worthless, that they're bad, that they're responsible, what has happened to them, and that is a big one. Kids often blame themselves for the reasons why they're taken. So what we, in working with them, need to do is reinforce their good behaviors. Show them that they can do well. Because prior to this, they may have never had someone show them or tell them that they can do anything good. You reinforce the responsibility of adults. So in a child being taken from their home, maybe they told a teacher that their mom was shooting up, or that somebody hit them. And in making that report to the teacher, that teacher has to report that to Childline. So that's what took them from the home. So in reinforcing the responsibility of adults, we need to explain to them, you making that report was a good thing, because in that home you weren't safe. And it was your mom or your dad or your neighbor or whoever that committed that act, or was supposed to be taking care of them in those circumstances. It is their responsibility to take care of you. And they weren't able to do that. And then you want to help them develop good decision-making skills, because as we saw in that cycle, if they can't make good decisions, then a lot of times that cycle will continue, and we don't want that to continue because of the effects that we know that it has. So then they feel different. A lot of our foster kids feel weird because they aren't living in a home that's theirs with their parents. They feel powerless because they can't control what happened to them or what is happening to them. And sometimes they feel betrayed, whether it is by their birth family. Sometimes they feel like they have betrayed their birth family. So you want to help them to recognize where they do have power. They may not have power over the fact that they can't go home right now, but they do have power over how they act, how they present themselves, the thoughts that they think, the choices that they make. And then you validate their feelings that they deserve stability. Because like we said, what was normal for them is not normal for us. And what was normal for them a lot of times is chaos and instability. So in being in your home, sometimes they don't know how to react to that. And you may have to have that conversation with them saying, you deserve, as a child, to be in a home where you're safe, where you're fed, where you're able to be a kid and not have to take care of your parent. Okay? Something else we see is that they don't associate adults with pleasure. It goes back to that element where kids can't trust adults because adults were never trustworthy. So then they need to have positive experiences with you as an adult, and they need to have realistic expectations. So maybe they are expecting an adult to say yes to every single thing they want because that's what they believe adults should do if they really love you. But then you may need to turn that around and say, no, as an adult in your life, as somebody who is taking care of you, I have to set these boundaries so that you stay safe. And that may help them to come to a realistic expectation of what they can expect from adults. And in this, you're going to make mistakes. And that's okay. And they need to know that making mistakes is okay. Because up until this point, maybe they felt like if they messed up, then they wouldn't be able to go home. Or it's because they messed up that they were taken from their home. So they need to know that making mistakes are okay, and it's how you correct the situation, it's how you deal with it sometimes that really matters, not so much the mistake itself. So they are unable to elicit a positive response from an adult. We talked about that attention-seeking behavior. So because they want that attention from the adult in their life so much, they respond or they act out negatively in order to get their attention. So in order to correct that negative behavior, sometimes they need positive feedback when they do things well. And also there is what we call time in versus time out. Is anybody familiar with either of those two? So what is time out?
Time out's when they have to go away from you.
Mm-hmm.
And time in is when they still need the attention even though they did something they weren't supposed to do, so they come to you.
Okay,
and
so
sit with you.
Mm-hmm. So time out is they are off on their own, whether it's in a room, in a chair, for a certain period of time, right? So they can think about what they've done or get away from everybody so they can calm down. Whereas time in is being with you in that moment and maybe talking about what it is that they're feeling, right? And then having a discussion with them that behavior was incorrect. I can understand why you did it, but this is what we maybe need to do next time. That kind of thing with time out versus time in. Does that make sense to everybody? Okay. And sometimes they have difficulty with cause and effect thinking. We do see a lot of this with our teens who have been through trauma, and by the time they come into care if they're teenagers, they've seen a lot. Because it may not have mattered before. So that's something that you want to be aware of is our kids may not think about what their actions or their reactions may cause in terms of consequences, whether it is positive or negative. So those are some things that you want to keep in mind if they are having trouble with some cause and effect thinking. So they are unable to delay gratification. I worked with a child recently who he would hoard food, or he would shovel so much food in his mouth during meal times because when he was with his birth family, he was not fed properly. So he felt like he had to take in all of that at once because he wasn't going to be fed later. So his foster parents had to teach him that he didn't need to hoard because that next meal would come. And it took some time, but he eventually caught on to that. And that's something that we, in working with these children, need to be reminded of, is that we need to be patient in teaching patience. Because our kids don't always know what that's like, and as a survival skill, they have learned to take what they can when they can. So in teaching them patience, chances are it's going to be a little frustrating because they have no patience. So just keep that in mind whenever you have a child who is unable to delay gratification for anything, that they may not have that skill because before, to survive, they had to take everything that they could when they could. They are unable to make connections between their thoughts, feelings, actions, choices, and outcomes. So it kind of goes back to that cause and effect thinking. They can't process all the time what they're feeling or what they're thinking, and so they don't know how it connects to their actions and their choices and what the outcomes of all of that are. So you want to reinforce the good decision-making process and helping them to think through what it is that they were thinking when they acted out or what they were feeling when they acted out. and how that impacted their decision to throw a toy at a sibling or to punch the wall, or whatever behavior may have come from those thoughts and those emotions, and then how their decision, whether it was a split-second decision or they consciously thought about it, how that choice and those actions, how they impacted that outcome. So whether it was they were grounded, or now they may have to be put on medication because their reactions are so widespread that they may not know how to process all of that. So you want to make them or help them to think through why it is that they make the choices that they do. Does that make sense? Okay, and they don't always learn from experience. Because again, it goes back to that cause and effect thinking. If they can't think through the reason why they made this choice, then they're not going to be able to learn from that experience because there's nothing tying it. Like if they can't identify that cause, then how are they going to learn from it? Does that make sense? Okay. Okay, so sometimes they're disengaged from themselves and from others. Sometimes we have kids that are very withdrawn and they want to keep to themselves because that was safe. If they didn't interact with anybody, they didn't get in trouble. And if they didn't get in trouble, then the outcomes of, whatever happened at home didn't occur. So you want to work slowly on integrating them and letting them know that it's okay for them to be themselves and that they can be a part of the family, even though, whatever happened at home happened to them. Because like I said, sometimes they feel weird. Sometimes they have a really negative outlook on the reason why they're in care. So some of that stuff is going to take a little bit of time to get them to integrate with you and to interact with you on a level that will be beneficial to them because they disengage. They don't know how to act in your family. Like we talked about earlier, your expectations of them and what that was like at home are a lot of times very different. So you want to introduce their rules and expectations by priority levels. So if picking up their room is not more important than crossing the street with an adult, maybe hold off on the picking up the room part until they get the concept of staying with you whenever you're out in public, because before, maybe they ran off and they could have run into traffic. So those are some things you want to think about with kids that we're working with. Is what is the main priority that they need to learn in being in your home, and then work from there instead of laying this all out at them at once, because that will be overwhelming and they won't be able to get it right. And then it goes back to that self-condemnation, like they can't do anything right. So start with what is the priority in terms of being in your home, like what keeps them safe, and then you can work from there in integrating those rules and expectations. Okay, has anybody ever heard of adverse childhood experiences before? Yes? No? Okay. So ACEs, as they call them, it was actually a study done by the CDC about adverse childhood experiences are a lot of what our kids deal with. So the study that they did showed that when children experience one or more adverse childhood experiences, it leads to this pyramid of reactions. So if they experience an ACE or multiple ACEs, a lot of times they have disrupted neurodevelopment. So if they have disrupted neurodevelopment, then it impacts their social, emotional, and cognitive skills. So they have impairment there. Then if they have those types of impairments, sometimes they make risky health decisions, or decisions that could be risky for their health, if that makes better sense. So in coping with the ACEs that they experience, maybe they start drinking alcohol. Or maybe they start exhibiting really risky behaviors, such as driving too fast, being promiscuous in relationships, those types of things. So they have health risk behaviors. So then if they are exhibiting these type of behaviors, it leads to diseases, sometimes disabilities or social problems. And at the climax of this pyramid, it's early death. So all of these things are interconnected, and everybody deals with ACEs differently, but based on the study that they did, this is how everything connected together and what it ended up leading to. So in this study, they looked at what an adverse childhood experience has an effect on. They looked at health, they looked at behaviors, and then they looked at their life potential. So with the health factor, there were things such as obesity, diabetes, depression. With behaviors, we saw things like smoking, alcoholism, and drug use. And then in the life potential, they looked at like graduation rates, or whether or not they were able to achieve academically, if they were able to hold down a job. And the more ACEs that a child had, the risk for negative health and well-being increased. So for people who had 5 or more ACEs, all of these factors increased significantly because they suffered through these different experiences that had all of those impacts on them we saw in the previous slide. So an ACE, or an adverse childhood experience, this is the types of ACEs that they covered, were in 3 different categories. They covered neglect, they covered household challenges, and they covered abuse. Now, if you look at the graphs here, the biggest factor with neglect was actually emotional, when their parents or their caregivers weren't consciously there. If you look at the household challenges, substance abuse is the big one. Separation and divorce isn't far behind, and we actually see a lot of domestic violence and mental illness in this field. So there are a lot of these are combined. And then with abuse, obviously physical is number 1. Sexual really isn't far behind it, and emotional abuse, it obviously is a lot less, but especially in Pennsylvania, it's a lot harder to prove emotional abuse. So it would depend on what the CDC defined it as to whether or not emotional abuse had a significant impact. So this just gives you an idea of what the long-term effects of these types of experiences that our kids through can have on them. Does anybody have any questions about ACEs? No? Okay. Okay, so now we're going to get into some of the diagnosable things that can happen with our children. The first one we're going to talk about is FAS, fetal alcohol syndrome. So basically, it's talking about when, it's not when a mother drinks occasionally during a pregnancy, it's usually associated with heavy drinking. So there's like a constant exposure to alcohol in utero. So there are different results that can happen from that. Sometimes there are physical results such as skeletal deformities. Sometimes you see that in deformed ribs and sternum, a curved spine, hip dislocations, bent, fused, webbed, or missing fingers or toes. You see facial abnormalities such as small eye openings, skin webbing between the eyes, drooping eyelids, nearsightedness. So there are different facial abnormalities that can occur with FAS specifically. Organ deformities are sometimes fall under heart defects, heart murmurs, sometimes genital malformations, and kidney and urinary defects. And then the one that I have seen more of is the central nervous system handicaps. So these other things can absolutely happen with a child who has been exposed to alcohol in utero, but one that we see a lot of is what they are able to do based on their brain function after they're born. So sometimes that leads to a small brain. Usually, sometimes it can lead to intellectual disabilities. A lot of times that's mild to moderate, but sometimes it is severe. They have learning disabilities. Like I said, these are all like worst case scenario type of things. I did work with one child who actually was diagnosed with FAS. When she was born, one of the things that they look for is whether or not their bodies are really tense. And she had really tight closed fists whenever she was born. So she ended up going through occupational therapy and physical therapy. And thankfully, after going through those therapies, she actually had normal cognitive function after going through those therapies and helping her to develop normally in releasing and relaxing those muscles and the connection it has with the brain. So yes, there are very significant handicaps that can come with FAS, but like I said earlier, it's not an absolute guarantee that will happen to a child in your home if they have been exposed to alcohol. Does anybody have any questions about FAS? No? So now we are going to look at,
I had a quick question about
Yes.
FAS.
Okay.
Is the term FAS, I know it says alcohol in the name, but is that only used to describe cases where alcohol was abused?
yes, there is a
Or-
different one for for other substances.
Okay.
Yeah, and we will get into that in just a second. So with substance abuse, especially if a child has been continuously exposed to illicit substances such as heroin, cocaine, even methadone or Suboxone, which are used to treat drug addictions, we see what's called neonatal abstinence syndrome. So it's like FAS, but it's specifically for other drugs that are not alcohol. Sometimes with substance abuse and exposure in utero, we do have physical disabilities, just like there was with FAS. Sometimes kids are born deaf, sometimes they're blind, sometimes they are wheelchair bound or have permanent braces. Sometimes they have emotional disabilities, so they have adjustment issues or problems with their behavior or emotions. Intellectual disabilities can also be a result of substance abuse in children, so they're developmentally delayed in a mild, moderate, or severe manner. And sometimes it boils down to our kids have learning disabilities. So ADHD is a very common one. ODD, oppositional defiant disorder, is a common one. PTSD is, you see that more with children who had been exposed to severe trauma. Like there was a child I had worked with where the child's parent set their house on fire. So he had post-traumatic stress disorder from watching that and experiencing that. But sometimes there's also attachment disorder. Whenever we have children who have parents who use drugs and they can't trust adults, and they learn that from infancy, they have an attachment disorder. So they have learned that adults are not trustworthy and they can't form relationships with adults or with people because they've learned that they can't trust the world around them. That's the very first level of child development, is trust versus mistrust. And if a child can't trust the world around them, then it impacts the rest of their developmental ability. So now they can't form relationships with people, and that has a really significant impact on them. In your giant packet of things, there are some handouts on attention deficit hyperactivity disorder, oppositional defiant disorder, and on PTSD. So if you want to read more into those are in there for you. I just wanted to mention them because, especially ADHD and ODD, we do see a lot of kids who have those diagnoses. PTSD is one that you can see. It's not always a factor, but there are some children who are diagnosed with PTSD, and then there are kids who have an attachment disorder, or sometimes they have what we call RAD. It's a reactive attachment disorder, so it's almost like a step up. So they can have some really, there can be some really negative consequences to kids who are in care because of substance abuse issues. Does anybody have any questions on this part? Nope, okay. There is a strong correlation between substance abuse and disabilities in children. With parents using substances and the needs that children have, a lot of times that's where we see these learning disabilities. But because a parent has used, or a mother has used substances while the child is in utero, a lot of times we'll see the physical, emotional, and intellectual disabilities that can occur. Okay, so does everybody understand foster care versus adoption? Like what is the difference between foster care and adoption? Does anybody know?
Adoption, you legally adopt, you are a legal guardian of a child.
With adoption, you are actually their legal parent. What happens in an adoption is they do go through, their birth parents go through through a process called termination of parental rights. So in the eyes of the courts, legally, once that happens, that parent no longer has any rights to their children or their child whatsoever. So in an adoption, because rights have been terminated, the adoptive parents assume the legal rights and responsibilities of the birth parent. And what happens is they actually change the child's birth certificate so that their adoptive parents are listed as what the court would call their natural parents. So at that point, that's when the adoptive parents have all legal rights and responsibilities. You no longer have to go through CYS for different decisions that you want to make on behalf of that child. You have the responsibility of that child. In terms of being a legal guardian, that's actually a different process. It's called permanent legal custodianship, whether subsidized or unsubsidized. So you can either get paid for it or you don't. But that is when they don't require termination of parental rights, but you have legal custody of that child. The difference between PLC and adoption is at some point, if a child has reached permanency through PLC, their birth parent could fight for that child in family court. A lot of times we don't see that because of the costs of having to go to court, getting an attorney, those sorts of things, but it can happen. So in terms of the levels of permanency, that's why the state prefers adoption, if possible, because it is the most final form of permanency. But permanent legal custodianship isn't far behind, because although parental rights aren't terminated, for a parent to regain custody of that child, they do have to go through a process and have to fight for that child in court. Does that make sense? Okay. Has everyone gone through prudent parenting, or do you know what it is? Okay, so for those who don't know, can someone explain what prudent parenting is in just general terms? No? Okay. So prudent parenting was actually a federal law put in place in 2015. I mean, this is a part of it. I forget the actual name of the law, but prudent parenting was one of the factors put into it. So basically what it said is that foster parents are able to allow their foster children to have as normal lives as possible. So with sleepovers, prior to this law being put in place, a child, the family that they wanted to stay at, their house, or go on a camping trip or whatever, everybody over 18 had to have clearances, and you had to go through certain hoops and whatnot for that child to be able to do that activity. So a lot of kids didn't do them because the hassle was too big. So now with prudent parenting, kids are allowed to go on sleepovers. You don't have to get clearances for everybody in the home. The 16-year-old can get their driver's permit. You can get the child's haircut. And, there are a lot of factors that play into what you're allowed to give that child or allow that child to do, so it normalizes their experience as much as possible. Because
does that include medical too?
no, there are 3 things that don't. And that the parents still withhold certain rights. So education is one, religion is another, and then medical is the third. So for routine medical appointments, they have to go for their well child exam. They need routine immunizations. They need dental care every 6 months. That's all stuff that you as foster parents are able to do. However, if there is something that requires invasive surgery or something that requires anesthesia or anything beyond routine medical care, that requires a parent's consent. With religion, the religion of the birth family is what holds the most weight. There have been families in the past where let's say for example, I've had a family recently where birth mom was Hawaiian and had very significant religious and cultural aspects of, because she ethnically descends from the Polynesian race. So when the child's foster parent got her haircut, her mom really had a problem with that, because in the Polynesian culture, you don't cut your hair up until you're at least, I think it was 6, if ever. So at that point, that's when foster parents should have been aware of the culture and the tradition in the Hawaiian heritage, because it was a cultural and a religious factor for birth mom. Birth mom trumps in that regard. However, I've had a lot of questions about whether or not you can take your child to church. The way that it was explained to me when I first entered this field was that unless a birth parent explicitly explains that they don't want that sort of thing to happen, because that has happened, then you have to abide by whatever they say. But if there is no significant explanation or a specified statement saying that they don't want their child in church, or they don't want their child doing this or that, or they have to go to this specific religious facility, it's not usually a problem. Does that make sense? Okay.
So you're saying that if they're of a different religion or faith,
Mm-hmm.
we would not be binded to, it's one thing that they wouldn't be able to practice any faith or religion that we had, but are we binded to then have to take them to their associating religion?
If the birth parent says that that's what they want for the child, then yes. By law, you would have to take them. Let's say the child was born into a Muslim family, and their birth parent has made it very explicit that they want their child to continue in that Muslim faith. By law, you have to take that child to a mosque for that religious upbringing, because birth parents still hold all religious rights up until rights are terminated, if ever.
I guess I need to be a little bit more specific. That would make sense that they want them to practice that religion, but we're then stating we have to take them. Let's say people don't have a religion, but we are then having to change our normacy. Let's say we don't practice a certain faith, and now we have to go to that
The child
chapter
does.
for that Sunday
You
or
as-
whatever it is. You know what I mean? Like, I guess what I'm saying is, like, it's almost like they're telling us how to raise that child
Keep
to
in mind
some
that
degree.
with all of this, the primary goal, at least initially, is
Mhm.
reunification. So keeping those ties, especially when birth parents have these rights, that's part of the goal with keeping those rights with the parents, because religion is a very big factor. So if you don't practice any sort of religious activity, but you have that Muslim child in your home, you as a family, as far as I am aware, and I will look into this more for you, that child is supposed to practice those religious practices and go to that religious institution. You, as a foster parent, as far as I am aware, do not have to do that. It is the child, because it's the child's birth parents who are saying they want their child to continue in that religion. Does that answer your question at all?
It makes sense, because if the child's 4, you're not going to just drop them off at the sector and say, go practice and we'll pick you up later. You know what I mean? I guess,
Yeah.
thank you for that clarification, and I was just trying to really understand what that meant,
Mm-hmm.
because I know there's different religions or people that don't practice or whatnot, but
Right.
I want to be very clear that there's a, I want to say a demand, because that's a terrible word to say, but if they're demanding that you take their child every Sunday or this, that, and I don't even know if it's Wednesdays or whatever it is,
Mm-hmm.
that they are demanding that you do that every Sunday. That's
Uh-huh.
just not something that I was aware of.
Okay, and that's why we are explaining prudent parenting, and you will go through a specific prudent parenting training at some point during this process, because that's required by the state. I'm just covering it briefly because it does play a factor into the sense of normalcy our kids are allowed to have. Does that make sense? So whoever does that training with you, or if you do it online or whatever, they'll go into much more detail about these things. Okay, so with education, if you want to move the child in your home from one school to another, whether it's from public to public or private to private, the birth parents still hold educational rights, so you would have to get their permission to move that child from one school to another. Does that make sense? Okay. Moving on.
With education,
Yeah.
a lot of times in the past, the caseworker, for instance, the one girl that we just adopted,
Mhm.
before we adopted her, she dropped out of school, she was 17.
Okay.
She wanted to go back to high school.
Okay.
Her birth mom refused to let her.
Okay.
So I pushed to get the courts to sign off, and they signed off
Okay.
with no problem. So a lot of the time it depends on age too.
Mm-hmm.
I mean, they're not because birth mom didn't want her to go back to high school, just wanted her to get her GED, but yet she wanted to go back to high school.
Okay, so
And
she
she's
wanted to.
graduating in 14 days, so.
Okay.
You know, a lot of times the courts will, if it's good reason,
Mm-hmm.
the courts will oversee both parents.
Yes.
You
Which
know,
is really weird, because you would think that anybody would want their kid to go to school.
You would think.
It's a law, I mean, isn't it? And I thought,
Yeah, you'd think.
But we had
but
to fight to get that kid to go back to school.
every birth parent is different though, and what
Yeah.
her expectation of her child may have been, or what her expectation of the school system may have been. Who knows? But you know, Barry and Amanda are right. If it is court ordered that something happened, so if it is education, the courts can overturn a birth parent's right if it's for the best interest of the child. Same thing with medical. There was a case that I had where a child had to have extensive dental surgery, I think it was, and the caseworker was unable to get in contact with the birth parents. So they actually went to the court and had the judge sign off and say that this child could have the surgery because the child really needed it. Even though birth parents weren't contacted or if birth parents refused, you know, there are certain circumstances where the courts will overturn what birth parents say if it's in the best interest of the child. But it is a process, and sometimes it's advocating for your child in order to get that overturned. So there are those options there. That's something that you want to keep in mind with these parents still holding these rights. They are the rights of the birth parents for education, religion, and medical. But if it's in the best interest of the child to go beyond that, then you may have to advocate for them and say, you know, they need this surgery, or they need to go back to school, or this IEP, or, you know, whatever it may be. And the courts may actually listen to you or listen to the caseworker in that regard. Okay. In your packet, there is a sheet. It lists the differences between foster care and adoption. Sometimes when we have families come in who are specifically looking to adopt or be matched with a child, and they have a child placed in their home, it's a struggle because they want to be the adoptive parents. However, at this point, they are the foster parents. So having that list to see what the differences are can be really beneficial in reminding you, you know, at this point, what role do I play? And when I'm an adoptive parent, what role would I play then? Does that make sense to everybody? Okay. Okay, so something that we look a lot at, and we've talked about significantly through this, is why do we adopt children from different families? What's the motivation? Why do we do it?
Give them a chance in life.
Give them a chance? Okay. What'd you say, Amanda?
More permanency.
More permanency. Anybody else? Why do you want to adopt, if you want to adopt?
Sometimes it's for your own family, for your own thing. You want to see gratification for yourself for seeing a kid, raising kids. And,
See gratification of raising kids?
yeah.
Okay. Anybody else? Okay, so the reason that I bring this up is sometimes our motivations and our expectations do not necessarily match reality. So sometimes, and I'm going to admit, I don't know how old this worksheet is. It seems like it's a little bit outdated. But there are families sometimes that come in and they want to adopt because for whatever reason, they are unable to have their own children. And while that is not a disqualifying motivation for wanting to adopt a child, that's actually a very common one. One thing that family may want to keep in mind is, are you relying on that child to fulfill your life? Because when the child is brought into your home, what you think they're going to be like or what you think they're going to act like may be very different. So, and when you have those unrealistic expectations on that child, then sometimes that causes placement disruptions. Sometimes it causes adoptions to blow up. There are a lot of factors that can play into how those unrealistic expectations or the maybe improper motivations can really have an impact on the child and the family. For instance, with a birth family coming in and saying, we want to adopt a child because we've never been able to have our own. If they have the expectation that they'd feel whole if they would feel as whole as if they had had a birth child, adoption doesn't make that pain of not being able to have a child, or in some instances losing a child, it doesn't go away just because you've adopted a child. Because then your expectations of what you thought your child would be like and the expectations of the child you've adopted, maybe you may think that they're the same, but then when that child grows up and the reality of their life prior to being in your home comes out, especially if it's an infant, sometimes that puts very unrealistic expectations on that adopted child, and that's not fair, which I would hope we could all agree. So those are, in bringing this up, I would ask you to question your motivation and your expectations in bringing a child into your home, and if permanency is achieved in your home, why? Why do you want that permanency to be achieved in your home? Because that may better help you to understand why you have the expectations that you do, or why you think the things that you do about that child. So then when reality happens and permanency is established, those expectations you have for that child aren't unrealistic and aren't going to put unneeded pressure on them. Does that make sense? Does anybody have any questions? Okay. Okay, so there are some very significant issues that adopted children have, and it doesn't matter if they were adopted at birth or if they were adopted at 17. Every child who has been adopted at some point, especially if they know or they find out, is they suffer from some sort of loss. Whether they knew their birth family or not, they acknowledge that a piece of them seems to be missing because they are no longer with, or they don't know, their biological family or their birth family. They struggle with their identity. We see this a lot with children who come into care. Before, they were a part of one family. Now that they are in your home or you have adopted this child, now they struggle with the idea of having two families. And sometimes there's a battle with, we'll get into it a little bit later, but with loyalty as to whom they are allowed to love. Do they stay loyal to their birth family? Are they able to be loyal to their adoptive family? Is there a possibility that they could have an identity with both? And it goes into, so sometimes what we see with kids is if they love their birth family or if they love their adoptive family, then they're betraying the opposite. So in this work, something that you want to make known to your kids is that they are allowed to love their birth family, that they are allowed to have enjoyed time with their birth family, but that it's okay for them to love you guys too. And I would hope that their birth parents would reciprocate that to them. However, that doesn't always happen. But they need to know that it's okay to have two families, to love both families, and to be a part, of both families, because they may feel like they're betraying one or the other if they love one or the other.
Sometimes that changes. You can adopt a kid,
Mm-hmm.
and that kid change their feelings down the road, and so you gotta be prepared for that too.
What do you mean, Barry?
Like if you go ahead and take adoption, that kid's not yours.
Mm-hmm.
And they're older, and they know that.
Yeah.
They wanted you to do that.
Okay.
But their mind, and we had an instance, she changed her, she wants now to communicate with her family.
Okay. So you adopted an older child,
Yeah.
and
asked to be adopted.
she asked to be adopted, and now she wants contact, or she wants to be with her birth family?
She contact.
Okay.
Yeah, but
Yeah.
she's not allowed to
Okay.
contact. It's not that we don't allow her.
Okay.
There's a court
Is there a court order saying no
order
contact?
that they're
Okay.
not allowed contact.
Okay.
But because of her age, she feels,
Like she should be able to contact
Yeah.
her birth family. Okay. Okay,
Yes,
and
it just, in our cases, so
I'm just bringing it up, yeah, I mean, things change.
we get
yes,
those
things do
unique
change.
Yeah.
Yeah, and it's not uncommon, especially if you have a young child or an infant who's adopted, that if they find out they're adopted or when they get older, they might want to search for their birth family if they don't already have contact with them because they feel like that piece of them is missing. Or because they want to know who they look like, or who do I get my art skills from, or sorts of things like that. So they may want to have contact with their birth family when they're older. That's something you want to be prepared for as well.
Yeah, and they're kids,
Yes.
and this is all happening as they're kids too.
Yes.
So you have to put that in, I just wanted to bring that up.
Yeah, and that was a good
prepared.
point to bring
Yeah.
up, because sometimes in wanting to have contact with their birth family, whether it's they can't, like they literally cannot because of a court order, or because their birth family wants nothing to do with them, sometimes contact isn't possible. So then there's dealing with that element of it and helping them to understand you can't have contact with your birth family. It's not that I don't want you to, but this is the reason why. And sometimes you may encounter that, just like, Barry and Amanda are dealing with that right now. That does happen as well.
And when they get older, there's nothing you can do about it. But they'll be adults then, and they have to, then we can explain that to them. Yeah, wait,
Yeah.
when you become an adult, you're an older person, and if you want, then you can, but right now we can't. It's like,
Right.
so it's tough, yeah.
Yeah, once you hit that 18 mark, then they can, kind of do whatever they want in that regard. But it is that, right now we can't. If you turn 18, that would be, up to you, because you're legally an adult at that point. So those are things that you want to keep in mind as you go through this process, and if you end up adopting a child. Sometimes they struggle with attachment. Sorry, I'm forgetting this one.
I have a question.
Yes.
These are possible issues, correct?
These are actually very common issues for
Okay.
adopted children. And it doesn't matter at what age they were adopted, because whether a child acknowledges it or knows it or not, there is that loss that comes with an adoption.
I can understand that, and I guess what I'm asking is, there could be a sense of loss. However, it doesn't mean that every child is going to experience every one of these situations
No.
ever. There could be a situation where, if they're in a loving home and they've been able to deal with life consequences or decisions, that it's not that big of a deal.
Sometimes, yes. But sometimes, even if they have been in a loving home, they still feel some of these because they don't know.
want to know what their birth family was like.
Yes.
Like we adopted
Yeah, there's a bond.
young ones also,
Mm-hmm.
but since then, the one, she has SADs, so she has no clue, but
Okay.
the other one, she knows that she was adopted,
Mm-hmm.
but we also have talked openly and freely about her birth family. She
Yes.
can tell us the horrible stories
Mm-hmm.
and why she doesn't, at this age, doesn't want have anything to do with her mom. No, in 8 more years when she turns 18, who knows, she might want something to do with her, but it just all depends on what age you decide to tell the child. If you adopt one that's young and you're not telling them that they were adopted, depends what age you reach out and tell them that they were adopted,
Or if they find out.
or if they find out before you have a chance to tell them.
Yeah,
And-
something you can do everything right. It's not your fault as a foster parent. So I'm
Yes.
trying to say it's not as a foster parent. It's not you're doing everything. You're giving them all the love, all the care, and that. But be prepared. It can happen that kid wants to know who their
Yes.
real parents are, because there's something there, and I can't explain it, but it is there.
Mm-hmm.
In almost all cases I've seen, the kid's curious.
Yeah.
And they want to know.
When children are adopted, and if they know they're adopted or they find out, they do want to know. Because, and we see this a lot with international adoptions, like my parents don't look like me. Why do I have dark hair and dark eyes and my mom has blonde hair and blue eyes? And my dad has blonde hair and blue eyes. Like, that's not normal. So like Barry said, it doesn't necessarily matter what age they are when you tell them that they're adopted, and sometimes they find out that they're adopted. Something that happened in Pennsylvania not too long ago, it was a law instated in 2010 that allows adoptees or birth parents or birth grandparents with certain criteria to be met, or birth siblings with certain criteria to be met, to search for each other. So you could have a birth parent searching for their adopted child. There again are certain criteria that have to be met, like that child has to be over the age of 21 in order for that birth parent to search for them. But if the child's 22 and they have no idea that they're adopted, someone like that's part of my job at Catholic Charities is I'm an authorized representative. When people come to me looking for their birth family members, assuming that it's safe for everybody involved, and I do that search, that person who's adopted may not know they're adopted when I contact them. So who would they want to hear it more from? Their adoptive family who loves them and wants to take care of them and can help them process all of that, all of the emotions and everything attached to being adopted? Or would they want to hear it from a caseworker who's trying to get in contact with them because their birth mother's looking for them? So if you do decide to adopt a child, ultimately it would be your decision as to whether or not you tell that child they're adopted, if they don't already know. However, working in child welfare, we would strongly encourage you that you do, because of these sorts of things. Because if a child finds out that they're adopted, they may experience all of these things at once, and everything that you knew about the family that you built with this child may all of a sudden blow up in a sense, because they have just learned that you are not their birth parent. And like Barry said, there is a significant, for lack of a better term, relationship between a birth child and their birth family, whether they know it or not. And kids want to know about their birth family. They want to know why you didn't tell them that they were adopted. Like, they have a lot of questions and may have a lot of negative emotions about finding out that they're adopted if they find out later in life, as opposed to being told the entire way through. Does that make sense? Does anybody have questions?
Something else I'm trying to say is I wouldn't let that stop you, but just be prepared for it, because that love's still going to be there. You're still going to raise that kid.
Yeah.
You're still going to get that. And you're going to have that, and that's going to always be there. And that kid's getting something out of it too, and when in a relationship. So you're getting it, they're getting it, they're still family, but you just have to be prepared down the road for expanding that and sharing that love that they may have with their birth parents.
Yes. Yeah, you want to be prepared for if they would decide that they want contact, to be able to share them with their birth family. Okay. We keep going. So sometimes with adoption, they experience rejection. They ask that question, why did my birth family give me up? Or why couldn't I stay with my birth family? If they know, or they find out the circumstances surrounding their adoption. Sometimes they experience low self-esteem, or they anticipate rejection from other people because they feel like they were already rejected or abandoned. There is a level of guilt and shame. Sometimes they blame themselves for what happened to them, even if it was completely beyond their control, and we know that. Sometimes they feel guilt and shame because they're adopted. So these are just some of the issues that you may find with a child who has been adopted. And they do have a lot of struggles with control, because they couldn't control the circumstances surrounding their adoption, whether it was, their birth mother just couldn't take care of them. So when the child was born, she allowed them to be adopted. Or if they were in the system, like the kids that, we would be working with would be, as to why they were in the system at all. And, if I had just been better, or if I had done this, or if I hadn't done that, then maybe this wouldn't have happened. So they feel like they have no control over the reason why they were adopted and the fact that they were adopted. Okay, so I'm going to go over this briefly. There is, again, a page in your packet about positive adoption language. The reason that we bring this up is because using positive adoption language, using language at all, tends to have an impact on a child's identity. Like, for instance, we use the words biological mother or father, or birth mother or father, rather than natural mother or father, or a big one is real mother or father. You know, the difference between a birth mother or father and an adoptive mother or father is one gave birth, one adopted. That doesn't make either set of parents any less real. Does that make sense? Okay. Another one might be, you know, courts terminated parental rights versus the child being taken away. So it may imply that if a child has been taken away, that the courts or the county agency or however that came about took the child from the birth parents. And that's how the situation started. Rather than the courts terminating parental rights, and then you can go into that explanation as to why the parental rights were terminated. So in using this sort of language, you are building up your child to understand the reason why they were adopted, and that even though the circumstances leading up to their adoption could have been very negative, that adoption is a positive thing. You didn't take them from their birth parents. You adopted them, and there were circumstances surrounding the reason why their birth parents' rights were terminated or why they voluntarily placed their child for adoption. Does anybody have questions about positive adoption language? Excuse me. Nope? Okay. Again, we're going to go over this real quick. There are certain resources that are available to you as foster and adoptive parents. One that you will probably hear a lot of if you haven't already is SWAN, the Statewide Adoption and Permanency Network. So those child profiles and child preparation services I mentioned that I do earlier, SWAN is the overhead organization that handles all of that. But they also have a lot of other services in place in order to help adoptive families after an adoption has taken place. We call those post-permanency services. So if you would contact SWAN and say, my child is having a really hard time with this, that, or the other thing, or our house is blowing up right now because my child can't handle this certain thing, you could ask for post-permanency services, and then they'd send somebody to your house to help you work through some of those adoption issues that we talked about earlier. There is the Pennsylvania Adoption Exchange for anybody who does not already have an identified child or is specifically looking for a match. This is where you can find children who are already available or who are looking for families specifically. AdoptPAKids.org is the website for pay. There's also AdoptUSKids.org. It's basically the Pennsylvania Adoption Exchange for the entire country. So caseworkers from all over the country have created profiles for children in their care who are looking for families, and they have not been able to find a family in their state at this point, so they have decided to reach out of state and see if there are families in other states who might be willing to take in or adopt the children that they have written this profile for. Another resource available to you is the Pennsylvania Health and Human Services Resource Guide. So it's through Value Behavioral Health, which is the mental health insurance more or less for our kids who come into care. They have a list of mental health providers in Pennsylvania who may be better able to help you if your child requires those types of services. Does anybody have any questions about some of these resources? Nope. Okay. So overall, there are 420,000 children in foster care in the United States, and they are removed from at-risk or dangerous situations. So like those scenarios we talked about before, they are placed in temporary homes, but a lot of times those homes become permanent. And in overall, millions of children have been in foster care. There is an importance of connecting these children with adults, whether they are young children or teens, because at some point they will become teenagers, they will become adults. And when children who have been in care do not have those connections with adults who can teach them and who can be examples for them, that's when we see a lot of these statistics. When they hit 21, which is the aging out, the oldest age a child can be when they age out of the system. They experience homelessness. They are unemployed. 71% of the females who were in care become pregnant. 77% of the men who were in care are arrested. And then 20% of those become career criminals versus the 5% of the general population. So if at any point you feel like the work that you are doing does not matter, this shows that it does. Because without those adult connections in their lives, this is what happens. They don't graduate high school. They don't go to college or to a trade school or get a job where they can, survive or to live. They are unemployed. The cycle continues when those women become pregnant. The cycle continues when those partners are incarcerated. So these are all factors that when you're looking at the grand scheme of things and you're wondering why you were taking these children in or why you're looking at adopting them, it's because ultimately this is the end result you want to avoid. And that what you're doing and showing them healthy relationships and that adults can be trusted can help prevent some of these things from happening. Okay? We are going to watch a video. If anybody has already seen it, we don't have to. It's called Removed.